All right, so welcome everybody, and this may be a 30-minute video, but I'm not 100% sure because Randall got this whole thing set up. So let's get this thing rolling. And so what we're going to do is we're going to start out with make sure that when a patient comes into your clinic, you're either giving them your #1 best-selling book or you're giving them the magazine, Trusted Advisor magazine. You're going to shake their hand when they come in. Okay, this is my exam room right here. All right. Today I had a 25% close rate. I had 4 people come in, 2 I didn't accept for care. One woman's knee was so jacked up, it was like pathetic at 47 years old from surgery. One Parkinson's patient came in literally walking like this, drooling, bent over, shaking. Told him I wouldn't take it for care. He's too far gone. Another lady couldn't get care credit. And then the 4th guy I closed this afternoon. So that was a 25% close rate today. Now, so we're going to shake their hand, introduce themselves. You need to call them by their name, multiple times through this process. We want to know what their #1 complaint is. Okay, their #1 priority. We're going to go through that secondary priority. And then we want to do the OPQRST. Now, the critical component of that is, I think a lot of you are missing, is #1 is that you are not asking them on a scale of 1 to 10, what level do I need to get this to for you to be happy with the result? All right. And I don't care what they say. We want to say if there was if opportunity for us to get you as close to a 1 as possible, would you want to know about that? And the answer is going to be yes. Okay. So we want to get as close to a 1 as we can. So again, like the man that came in this afternoon said, I want to get a 0 if you can. So anytime they have an objection about everything we're doing, remember, you said, not me, you said that you wanted to get to a 1 or a 0, and this is what it's going to take to get there. So again, you're not closing them in the close, you're closing them in the report and the exam. And I think that's where everybody gets kind of lost, is they think that the close is in there, and the close is everything that you've done up to that point. If they come in with neuropathy, my staff is going to give them a percentage of loss of function because of what they filled out. We're going to use this sheet of paper here. And if they come in with hands, let's say at 50%, and then feet at 75%, we know they're in their severe range. And then here it's going to say that this is going to take 12 to 18 months. Okay. So, and then we're going to confirm that by doing this exam. So we've done the OPQRST. The patient says it's at a 7 or an 8. They want to get it to a 3 or a 4. If I could get it to a 1, would you want to know about that? Yes. Okay. We're going to pass by and not do the blood pressure. So y'all should all know how to do that. The first thing I'm going to do is I'm going to grab this infrared light, and I'm going to do a temperature of their face and compare their hands. And before I do that, I'm going to say, there should be no more than 2 degrees difference between your hands and your face if it's hands and your face and your feet. If this is altered by more than 2 degrees, then we're not getting adequate blood flow to our tissues. It's called tissue perfusion. All the healing is in the blood. Our white blood cells aren't able to get to the tissues. Red blood cells to give oxygen. All of our hormones are not able to get there. Our growth factors are not able to get to the end of our fingers and feet to actually create synapses, to actually create neuroplasticity so that we can actually heal these tissues. So there. Then we're going to do a tuning fork. If you have this as well, we're going to use this. Okay, that's the thermal scan. Red is what it should be all the way down. Then when it starts to malfunction, we go to yellow, green, and then blue. Blue is as bad as it can get. We're going to take this tuning fork. We're going to put it on your sternum. This is going to be our baseline. And then we're going to compare your thumbs and your toes to this sensation. So here we go. This is a 10. All right. And then what does this feel like compared to the sensation? And then we're going to go down to the toes. When we do this, we're going to tell them that, let's just say it's a 6 up here, just to keep it simple, 6 up here and 4 in our toes. So we've lost 40% function here, 60% function in our toes. Okay. So if we've done our pulse ox, which we should have, if we have decreased oxygen in our fingers, decreased oxygen in our toes. So right now we've got decreased oxygen, decreased blood flow, which means we're not getting hormones, we're not getting blood sugar, we're not getting oxygen, We're not getting the growth factors into the tissue to allow the body to heal. And then we're also losing sensation from our nerves being damaged. Now, the next thing that I'm going to do here is I'm going to grab the rebuilder gloves, and I'm going to set this on the table because the patient's going to be sitting right here. All right. The patient will literally be sitting right here. I'm going to put this rebuilder, I'm going to put the gloves on, and I'm going to tell the patient, which is sitting right here, turn this knob up until you actually feel the sensation. All right. And then when they're done, and sometimes you have patients that's like, well, you turn it all the way up, and it's the same thing as turning it, going to in your car and turning the car volume all the way up, and you're like, I can't hear anything. Okay. Then we're going to have them grab their hand. I'm also going to have the spouse grab the hands, the spouse's hands as well, because they need to feel the sensation. And then I'm going to grab their feet again, and they're going to look at the spouse and go, wow, I can't even feel that. Okay. So now the next step that we're going to do is I'm going to go ahead and do the patellar reflex. I'm going to do whatever reflex that we need to do in the upper extremities and lower extremities. When we get to the Achilles reflex, it's vitally important to let them know that this reflex should be elicited at an 80-year-old. So if you're 80 years old, you should still have this reflex in a healthy person. So a person comes in, they're 47, and then they don't have that reflex, even though chronologically, Ms. Smith, you're 47, you're functioning as though you are 80 years old from a neurological standpoint. Now, at this point, if you haven't already done this, we're going to actually tell the patient, it's like, with the lower extremities, are you having any type of erectile dysfunction, or if it's a female, difficulty with sexual intercourse? And again, we've got to go back to the parasagittal space, because now this person has decreased oxygen in the lower extremities. They have decreased blood flow in the lower extremities. They have decreased sensation in the lower extremities, and they have decreased reflex in the lower extremities. So remember, if we have cold hands and cold feet, we're also having a cold brain. So just look at the homunculus, and you see right where the feet are in the homunculus, you have the genitalia as well. Then we're going to get down to the money part, where this next test is actually going to tell me the severity of the nerve damage. And then, Ms. Smith, what you need to know is this test here that we're about to do is going to tell you how much neurological damage you have, and then how long it's going to take to optimize your recovery. And this is what I know: the problem is always worse than what you think. It's going to take longer than what you think, and the financial investment is going to be more than what you think. So, and I know for some of you, it might be difficult to say that at this point, but the point is you're actually clothing them right here, because if they have any objections, they're going to say them right here. Like, well, and I really haven't had that many people say that, because again, we're leading from the front. I'm a #1 best-selling author, and they're in here because they're clinically screwed up, and they know that they're messed up. So I'm just confronting them with it and saying, this is more damage than you think. It's going to take longer, and the investment's going to be more. Don't say cost, say investment. All right. So we do the digit span. We explain it to them again, and then with how many fingers are between the fingers I'm touching, that would be 1. So we're going to do the light touch. If you missed this is 3 months. Sustained hold is 6 months. We do the digit span. Big toe is toe number 1, little toe is toe number 5. That's 9 months. We draw the 7, and then let's just say they get it at 7. We go up to the knees and then to the hands. So, and here's where some of you are going to be messing up as well. Let's say you do touch toe number 3 and toe number 4, and then you just stop there, which is fine. I mean, you do the 7 and they get it, but they need to understand that if you miss that, okay, if you don't do this program, you're eventually going to get to the point to where we neurodegenerate, and we're going to miss that, and it's going to take 12 months. And then if you miss in your knees, it's 18, and the hands, it's 24. They have to understand, if they don't do care, there's a price to be paid for that. Okay. So, and that's vitally important. So, and then we're going to go follow my finger. We're going to do the cerebellar test. Then we're going to do finger to nose test. We're going to do rock, paper, knife test, blind spot test. We're going to have them stand up with their Rumbergs, and you can go back and look at the last 3 videos that I've done on the cerebellum. You guys should already know that, but for me, the money part is, how long is it going to take to solve this problem? All right. And then when I get finished with this, I'm going to ask this patient, what did they learn? And I'm going to ask the spouse, What do they learn about this problem? Okay. Now we're going to shift gears and go into the report of finding. Now, one of the things that I do in the report of finding, again, is I'm going to show them structurally what's wrong with them. All right. Now, one thing that's important too, and I know it's different whenever I'm here talking to you guys, don't have a live patient. When I grab their foot and they can't feel that, or they decrease in that function, I want to also know, I'm going to ask them at that point, whenever we lose that nerve function in our feet, there's a nerve that goes from our brain to our gut that's called the vagus nerve, and it's highly myelinated, just like these feet are. And then, so tell me about your gastric reflux, your constipation, your diarrhea, how are you digesting food, and bloating, distension. Tell me about your focus, attention, and concentration, because once you link the gut in here with bloating, distension, and those kind of things, then we can go right to the brain. And then when somebody has a whiplash injury, again, then we can go from the gut, from the brain to the gut. So hopefully that makes sense, because the vagus nerve is myelinated. And if we have decreased function in the feet and hands, then we have to assume that since the vagus nerve is myelinated, that's going to be an issue as well. So then we come in here on their x-rays. I show them the bloating areas in their gut, where there's holes in their gut and that kind of thing. So, and then when we get to the report of finding, it's like I have a table here at the report of finding and a table here, and I'm literally sitting down just like this, writing out what I'm about to write out to you right here. So, and I tell them that this program is designed to do 4 things, and I've modified this since the last seminar, but it's designed to remove, repair, restore, and regenerate. Okay, let me see if I can get Sammy on here. He just came on. All right, hey Sammy. All right, so when I sit down here and I'm writing this down, remove, repair, restore, and regenerate. Okay, because the first part of this is going to be remove. It's going to be the 10-week gut, 10-week detox. So I write that down. 10-week detox is removed. We've got to get all the bad stuff out. We cannot rebuild new tissue. We can't repair it, restore it, regenerate it till we get the old tissue out. And then part of the repair, restore, and part of the repair and restoring is doing all of the metabolic testing. Now, remember, Mr. Smith, you asked me to get you to a 1 or a 0. This is my #1 policy to do that. So if they give you any shit whatsoever, then remember, you're the one that told me you wanted this, just like the guy that came in with neck pain and numbness in his hands. You told me you wanted me to get you to a 0. This is what it's going to take. Okay. So, and again, never sit there and justify your position. They're the one that told you they wanted a 0, so you better give it to them. All right. So right across here, repair. We're going to have to remove, repair, restore, and regenerate. So we're going to break this down into 4 subunits. Remove is the 10-week gut detox. Okay, we got to get the waste out, the bad parts out of it. We cannot rebuild a home till we get rid of the dead wood. Okay, and then we're going to do lab core. This is part of the repair phase and restore phase. We're going to do a lab core. We're going to be looking at your anemia. We're going to be looking at your glucose. We're going to be looking at inflammation, liver, kidney, heart, and endocrine function. We're going to be looking at the leaky gut, thyroid. Somebody's banging like they're cooking something. Mute your phone. Okay. So if you're cooking something or banging utensils, please mute your phone. All right. Then you got to explain. That's Andrew. So
it's not me. Oh,
so,
it's
all right,
Sammy.
So with our Cyrex rate #2, that we have to explain what that is, the leaky gut. What's a leaky gut? I say, Ms. Smith, what is a screen door at your home? What does it do? It keeps air out, less air in, keep the bugs out. I make them say that. This is what we're doing here. 80 to 90% of patients have a leaky gut, according to the scientific research, and doctors don't test for this. This is the #1 cause of inflammation in your body: joint pain, brain fog, focus, attention, and concentration. All right. Then we're going to say if this comes back positive, you're going to have to do another 20-week detox. Then we're going to do Cyrex 3x4 checking for gluten sensitivity, celiac, and any cross reaction. If we have this, we will also have to remove this from our diet. Okay, we're going to have to remove that from our diet because this is neurotoxic. Then we're going to be doing Cyrex number 5, we're going to be looking at any autoimmune disorders. Okay. And we're going to have to repair that. And then secondly, the next thing we're going to have to do is Cyrex Array 12. We're going to be looking at 29 different pathogens in your body, everything from dental issues to parasites to amoebas to mold and ticks. And then the last one is links test. Now I know we do Cyrex 11, but I don't go through Cyrex 11 on that. So, and I just tell them that this is the way I look at everybody from now on. Exactly the way I look at it. If you don't get your shit together, you're going to die from a heart attack, cancer, okay, or dementia, because Alzheimer's is the number 3 leading cause of death in America. So I feel like everybody that comes into this clinic need to have the opportunity to get these tests ran, and that's exactly what I tell them. Now, part of the repair phase, okay, is actually coming into the clinic. You'll need to come into the clinic 3 times a week for 3 months, or whatever that program is that a person has set up on. And then we're going to list over here on this side what all the therapies are going to need according to your neurological exam. All right. And then down at the bottom, I say that we have a medical doctor, and if she approves you for this program, we're going to do platelet-rich plasma. And this is going to help restore the joint integrity. So we have removal, we have repair, restore, and regenerate. And we're going to take all 4 of those together to get you as close to a 1 as possible. All right. And then I write down here, down at the bottom, I handwrite this, and whatever the neurological exam shows on the digit span test, I say this program is going to take a year, 9 months, whatever it is. And then I write down over here, I said, now let me go over the investment that you're going to have to make. The metabolic program, $89.07. The in-office therapy is $7,092. Okay. And then at the regenerative phase, each one of the injections that we do is $49.50. And very seldom do we have somebody that comes in, that's less than 2 areas that need to be injected. All right. So if we just pull out our trusty calculator here, then we can see that the retail fee on this, we'll just say this is a 12-month program. All right. We get our trusty calculator here, and that's $89.07 plus $79.02 plus $49.50 plus $49.50. All right. And that's $26,709. Okay. That's the retail fee. And then what I'm going to do, Ms. Smith, your program is 12 months, and I'm going to discount that to $13,961. All right. And I circle that. That's my number 1 policy. So see, this is the retail fee. If you paid for each one of these individually, that's what your fee would be. But we can put all this together, and you do everything on this page, and it's $12,000 or $13,961. So now, if you don't do regenerative medicine, this is how simple this is. If you don't do regenerative medicine and somebody's on a 12-month program, then all you have to do is you do this, and that's if you paid the retail fee. That would be, sorry, hit the wrong button. All right, so see, that would be $15,999. All right, and then what we're going to do is we're going to discount that. If you do this entire program, we're going to discount that to $13,961. Okay, and again, that $7,092. What's important? That's the first 3 months of care. That's not the whole 9-month program or 12 months. That's the first 3 months of care. Now, of course, if you had, let's say you had to do the Nexus brain-based therapy home unit, you'd put that down there. And then if you had your lasers, you'd put this down here in your rebuilder. So what I charge for laser and rebuilder, I charge $4,500 for that as a group. Okay, because you got to have a retail fee. They have to have some kind of value attached to that. And so it doesn't matter. Just make the number crazy. It doesn't matter. Just batshit crazy as to what, because it's just a retail fee. And then because what you're going to do is you're going to be the savior. You're going to come in right in on the white horse and go, you're going to get all of this program for $13,961 or $15,961 or whatever it is. So and today, literally the only objection, well, again, 2 people I didn't accept for care, so we never did a report of finding. But literally, one objection I had is the guy said, do you give a guarantee? And this is what I told him, which is honest to God truth. I used to give a guarantee, and then what happened is the medical board turned me into the chiropractic board, and I had to pay a fine, so I can't do a guarantee anymore. So you can call the state board and complain to them. All right. And then the second guy that came in that actually paid for care, he's like, man, I just moved down here, and it's like, you know, I just bought a house, and I go, I appreciate all that, but the point is, you're here suffering, and you can go out and buy another house, but once you die, there's never going to be another one of you. And my job is to help you maximize your health potential so that you can live life to your fullest if that's what you want to do. And you told me you wanted me to get you to a 1, and this is what it's going to take. And he sat there and thought about it, and he went up there and filled out care credit, and he got the credit application done for it. So the person before them didn't get the care credit. It was funny, they wanted me to give them a guarantee, but they couldn't even come up with the money on care credit to even pay for the damn thing. So I usually don't close people on the same day, but today is the last day of the month. So I figured, what the hell, just go on up front and do your care credit. But if you're getting a lot of objections, what this is meaning is your staff is not doing a good job of screening people, or you're doing the wrong type of marketing. You're marketing to the wrong people. You're not marketing to the chronically screwed up people that you need to be marketing to. And I mean, you guys have been to my clinic before, and I honestly, I may get 1 or 2 objections, because if you handle the person properly in this exam room, okay, if you handle them properly in the exam room, they know when they go into that other area that they're going to be dropping some coinage, and they're going to be dropping some Bitcoin on this one. Well, not necessarily probably Bitcoin, but the point is, they know, because I've handled them correctly, that they're going to be paying money, and it's going to, it's going to be more than what they thought. Because let's be honest, nobody comes in here and thinks that it's going to be, that it's going to be 9 months. They come in and they go, well, I think that, they're thinking it's going to be 3 or 4 weeks. I'll give you an example. The guy that came in that I did not accept for care, I told him, I said, look, this program is going to be 2 years. If you even came in here and did this program, okay, it's going to be 2 years, and here's what's going to happen. You are not going to get better. Okay. I'm going to try to slow this process down, but I'm telling you right now, where you are is where you are. And you should have been in here 10 years ago. But you are not going to get better. We can possibly slow this down. It's going to take 2 years, and that's $29,961. And he goes, well, he's like, well, I got what kind of Mutual of Omaha and all that. And he's like, oh, I've got good insurance. And I'm like, you got terrible insurance. I'm like, look at you. I'm like, and I said, what you're saying is, see, this is where I don't let people off the hook, where most of you would. Okay. Even though the guy's not doing care, because I'm not accepting for care, but, but the point is what he's thinking that he has good insurance, that he didn't have to pay anything out of pocket. Okay. And I go, look at your body. And I looked at his wife and I go, look at you. If your insurance was good and exceptional, you wouldn't have this problem. And he goes, well, I got Medicare as well. And I'm like, yeah, I know that. And I said, I can tell, because your doctors are working for the government. They're not working for you. And that's why you're in this mess you're in. But again, don't let these people off the hook. That guy knew before he came in here that we didn't take insurance. So whenever they say stupid shit like that, I'm just going to lay the wood to them. Okay. But that's just my personality to do that. And the thing is, some of you, when somebody puts an objection, gives you an objective, it's like you're afraid to even say something. And so if somebody says, that's a lot of money. Well, one thing, it's like, compared to what? What are we comparing this to? Compared to a car, a used car? And, what are we comparing it to? A boat? This is your life we're talking about here. And you have to make an investment in your life if you want to change it. This program was designed to do, you asked me to get you to a 1 or a 0, and this is the program that I'm offering you to do that. And then we can always default back to if you don't want to do the best program, you can always do the next best program, which is the $7,092, which is just the in-office therapy. So, and then, all right, so you guys, if you have any questions, which I'm sure you do, go ahead and unmute yourself and then ask some questions. And I was trying to get through this somewhat as quickly as possible, because it's, again, that's the mechanics of it. But if you handle the person correctly in the exam room, it's going to cut down tremendously on any objection that you have in the report of finding, because you're letting the patient know how long it's going to take. And if they bitch about that, then all you have to say is all you got to do to get it right. As soon as you get it right, that's going to let me know how long it's going to take to optimize your recovery. And because you told me you want me to get you to a 1, all right. And so this is what it's going to take to do that. I'm doing this exam. This is what it's going to take to get there. And then the key point is to, before you leave your exam room, you have to ask the patient, what did you learn today? And they better give you a specific answer. It can't be, oh, I learned a lot today. Give me one specific point that you learned today. What did I do and what did you learn that no other doctor has shown you? Okay.
Hey, Andy, got a question.
Go ahead.
I messed this up before. Patient comes in with Parkinson's or something. I go through the neuro exam and they get to the 9 months and they get it right after that. But they need, what I understood is they need care longer than that. I had a patient come in from my seminar strictly for short-term memory loss, but she previously had some neuropathy in her hands. So I didn't tell her how long it would take during the exam, but sure enough, she passed the gravitation. So how long with a patient with short-term memory loss is it going to take, like a year, 2 years?
Well, if you do all the metabolic testing, I wish I knew how long. Well, let's just put it this way. According to Bredesen, within 3 to 6 months, and they don't do any regenerative medicine or anything, within 3 to 6 months, if they follow the program, they should start to see improvement.
Okay, so when she comes back for the report tomorrow, just set her up for the 9 months, including the memory care.
Yeah.
Okay.
And because you can just tell her that it's like, look, you know, typically the people that I see take anywhere from 12 months to 2 years for what you're having. And obviously you got in here early. And so we're looking at 9, you know, you can always just say 9 to 12 months and just cover your bases.
Okay.
But just 9 to 12 months.
And then have her get the Nexus and the laser to use at home.
Absolutely.
Too.
Absolutely.
Okay. Thanks, man. This is great.
Absolutely. Absolutely. And so it does happen with me, but it doesn't happen very often. And if I see that somebody's coming in and they've got some memory issues and those kind of things, I'm just going to say it's going to take a minimum of 9 months, possibly 12. Okay. And so that, but again, it does happen sometimes, but it's less than 5% for what I've done. And so more questions for you guys.
Andy, can you hear me?
Yep.
So Nikki sent me the codes here. I'm looking at it on my other laptop, and you said lab. Are you doing either or? Are you doing LabCorp or Cyrex? And you're doing more Cyrex now?
Okay. All right. So what happens is, like next month when you got, well, next month will be December because it's still November. But when we get into January, you will see that what I'm trying to do is people that come to I've got 10 minutes left on this and it's going to automatically shut down. So if I actually am talking and it shuts down, it's just done. Okay. All right. So when I have patients, like next month, when I have doctors that come in, I'm going to show them how to generate almost $130,000 just by doing one thing. And that is do the 10-week detox and get the EnteroLab. Once you get into the program, we don't do the EnteroLab anymore. And we substitute that for Cyrex 3X and 4. But until you can actually get a draw company, just go ahead and get your Cyrex, go ahead and do the EnteroLab A2. But as soon as you get your lab, your draw lab or whatever it's called, and you should, there shouldn't be, I know you guys had a hurricane here recently, but after everything gets back to somewhat normal there, you're in Florida, so you should have a draw lab. If you just call Cyrex and say, look, I'm in Fort Myers, where's a draw lab close by?
Yeah, I have an any test now, like a couple blocks away.
Okay.
So I think they might do it. So that would be a draw lab, right? Not in my office yet. I want to do that, but so right now use them and be there.
Yeah, I'd just send them down to a draw lab and just let them do that. Okay.
Okay.
If it were more convenient, if we had a draw lab here in Tupelo back in the day, I would have done that, but we had to send them to a nurse practitioner to get it done. And they were always like, well, why are you going to a chiropractor and all that? So I just don't want to deal with that bullshit, so it's just, and then we just decided just to get it done in our office, and we had Nikki get certified as well as Maggie. So, and I'm glad you asked that, because again, we only, once you get that whole draw lab going, we're just gonna, because it's so much easier just to draw all the blood and send it off. You get it back within 3 weeks. And what happened with InterraLab,
Yeah.
put that thing at home and they don't take a crap in it. And then it's 3 weeks later and all the other stuff has come back and they're like, oh, I hadn't even sent the sample off. And now by the time it gets back, we're 6 weeks into it. And anyway, it's just, don't get me wrong. I love the InterraLab A2 because it gives you a lot of information about malabsorption and all of that. Gives you the 2 gene tests. But anyway, I just stopped doing it just simply for convenience is what I did.
Okay, so no LabCorp, because you mentioned some blood work for the thyroid. So
we do LabCorp as well, and she should have sent you all the codes for that. And if she did not, make sure you call her tomorrow so you can get all those codes.
I have them right here. I was just looking. Okay. Thank you.
All right, thank you. And then whenever you get all your blood work in and stuff, just call me and we'll get a time set up and we'll go over every bit of it. Because after we go through it a few times, it won't be a big deal. It's just the first time you get it and it's like, oh shit, where do I even start here?
Okay.
All right. All right, guys. Next question. We've probably got about 5 minutes. All right. And so this will be recorded. Tomorrow I'll get this sent to Randall. Hopefully this was beneficial to you guys. But the key component here is we've got to get the patient in the exam room. They've got to do the buy-in there because, again, the report of finding is just, it's a formality. It's a business transaction. Here's the problem. You want me to get you to a 1. This is the program that we're going to give you the best opportunity to get to a 1. So again, if anybody has any objections or they have an objection, all you have to say is, you told me you wanted to get to a 1, and this is what I'm doing. I'm doing exactly what you asked me to do. And you know what? If you don't want to do my best policy, then I've got a second best policy, my next best recommendation, or you can just come in and do the in-office therapy. Guys, I look forward to seeing you at Bryce's in just a few weeks. It's going to be an awesome time. And I can't wait to see all you guys. It's been too long, and I will be seeing you soon. So I'll get this recording out tomorrow and as soon as we can. So thank y'all, and y'all have a great evening and good night, everybody.